So Dr. Patrick and I are going to now talk about HIV, which stands for Human Immune Deficiency Virus.
Right. Let's talk a little bit about actually the risk factors for HIV or how you can get it.
Yes, there's basically 4 ways to get HIV, and that's blood, cum or pre-cum, bodily fluids, which includes vaginal fluids mainly. We're not talking about saliva, and breast milk. So remember that breast milk is a factor.
Right, and if we're talking about symptoms for HIV, they can be very varied, very general symptoms, but typically some people get some extreme fatigue, swollen lymph nodes.
Flu-like symptoms. Maybe you'll get some cold sores in and around your mouth, like canker sores or, fever blisters, some people call them, inside the mouth.
Right, and the reason you get these symptoms is because the virus is actually replicating at a very, very high rate, and it's starting to reach its peak when you get these symptoms. And these symptoms will go away as that peak starts to lessen as well.
Yeah, and that peak is in about 30 days. So, you're going to feel around 7 to 10 days. I've noticed some HIV positive patients have said, gosh, I thought I had the worst flu of my life. And sometimes if they have any other virus that's in their body, like HPV, genital warts, or herpes, they'll all of a sudden get an outbreak out of nowhere. And so it just it's hitting your immune system. So remember, it's waking up any virus that's been hanging around there.
Right. Now, some of the testing that we do, we have a couple of different methods. One is the HIV PCR by DNA.
Right. That's the early detection HIV test, and that can tell 10 days from exposure. So in other words, if you had sex today, we could tell 10 days from now whether you're exposed to HIV.
Right, and the other one is the old standby, the ELISA.
HIV ELISA methodology. This is a test that has a 6-week to 6-month window period. So if you had sex today, it could take up to 6 months from today to detect HIV antibody. It's an old standby test. If you don't have any sex partners, or maybe 2 or 3 sex partners a year, and you're having protected sex, it's a good old standby method to use every 6 months.
So actually, let's talk about some of the risk factors and your categories, actually. If you're a heterosexual female with one partner, for most of your life, your risk factors are fairly low. But again, if you're a sex worker or with multiple partners or
right.
a gay male or female.
A gay male, and you're having unprotected sex, your risk is going to be high. And we all know that. People always say, oh, hey, how much is the ratio with oral sex? We know that that's very low, that those statistics can be very low, but please use your head. If you've had a tooth extracted, don't going around giving blowjobs to your friends the next day, because that is an open area. And remember, also little things like Dorito chips or hot pizza or these type of things can create microabrasions in your mouth, and that creates microabsorption. So that's where HIV likes to transmit.
So let's talk a little bit now actually about if you do test positive, whether it's by the ELISA or by the HIV PCR DNA. If you do test positive, of course we will contact you in person.
Yes, we'll also be happy to contact your partners and give you local resources for you to get medicated, and we'll also have you retest with us to confirm that you are HIV positive. And we'll make sure that you have enough resources to feel comfortable wherever you are to continue your life as HIV positive. And remember, HIV does not mean AIDS. AIDS is acquired immune deficiency syndrome. HIV is a very early on syndrome of AIDS, so this is not the death sentence. You're not going to die tomorrow, and there's plenty of ways to have a normal, healthy sex life while you're HIV positive.
Right, so to recap, between the 2 tests of HIV, if you want to know within 10 days whether you have HIV or not, you want to get the HIV PCR DNA. If you're not that concerned and you think you can wait about 6 weeks to 6 months, then you want to get the HIV ELISA.